90% of couples are skipping the one step that determines whether sex feels amazing or just okay. And it's not a position, it's not a toy, it's not something you buy. It's a window that most people rush through in under two. I'm a urologist. I've spent years studying the science of arousal, not the myths, not the magazine tips, the actual biology. And today, I'm going to walk you through exactly what's happening in a woman's body during foreplay, why so many couples get the timing and technique wrong without realizing it, and what the research actually says works. This isn't going to be vague or awkward. It's going to be clear, clinical, and useful. So if you're ready to actually understand this instead of guessing, stay with me. Hi, I'm Dr. Lila Romano. I'm a board-certified urologist, and over the years, my practice has expanded well beyond bladders and prostates into something patients ask me about constantly, in whispers, after the real appointment is technically over. Intimacy, arousal, why something that should feel natural sometimes doesn't. Here's what I've learned after thousands of these conversations. Almost nobody was ever taught the actual biology. Not in school, not from friends, not from movies. People are operating on assumptions, and a lot of those assumptions are just wrong. So my goal today isn't to give you a checklist of tricks. It's to give you the science, how arousal actually builds in the female body, why it's often slower and more complex than people expect, and what real research says helps. Once you understand the mechanism, the technique almost takes care of itself. Let's get into it. The core problem. Here's the biggest misunderstanding I see, and I want to say this clearly because it changes everything. Arousal is not a switch, it's a process. For a lot of men, and honestly, for a lot of women too, because this isn't well understood by anyone, there's an assumption that arousal should happen quickly and in sync with desire. You feel like being intimate, your body responds, you're ready. That's actually a fairly male-typical pattern, and even that has more nuance to it than people assume. For most women, arousal works differently, and there's a specific piece of science behind this that changed how I explain it to patients. It's called arousal non-concordance. Research on this, notably by sex researcher Emily Nagoski and others, shows that a woman's mental sense of "I'm turned on" and her body's physical signs of arousal, blood flow, lubrication, don't always move together. You can have physical signs of arousal without feeling mentally aroused, and you can feel very mentally aroused with minimal physical signs. They're related, but they're not the same dial. Why does this matter for foreplay? Because a lot of couples treat physical arousal as the goal and rush straight for it, skipping the part that actually builds the mental and emotional readiness that makes physical arousal meaningful and enjoyable rather than just mechanically present. The second piece of biology I want you to understand is simpler. Blood flow takes time. The clitoris, like the penis, is erectile tissue. It engorges with blood when aroused, and that process, along with vaginal lubrication and the tenting effect of the vaginal canal, is a gradual vascular response, not an instant one. Research on the female sexual response cycle consistently shows this initial phase, often called the excitement or arousal phase, genuinely takes meaningfully longer to build than most couples give it. So when foreplay gets rushed, you're working against basic vascular physiology. It's not about a partner not trying hard enough or a woman being difficult. It's often just biology being given too little time. I see this play out in conversations with patients all the time. A woman will tell me, almost apologetically, "I just don't get turned on as fast as I feel like I'm supposed to." And my answer is always the same. You're not supposed to get turned on fast. That expectation itself is the problem, not your body. Once patients hear that the slower timeline isn't a personal shortcoming but a well-documented physiological pattern, I watch a real weight lift off their shoulders. That single reframe, "This is biology, not a flaw," tends to do more for a couple's intimate life than almost any technique I could describe. There's also a psychological layer stacked on top of the physical one. When a woman feels rushed, even subtly, part of her attention shifts to managing the pace of the encounter rather than experiencing it, which, as we'll get into shortly, actively works against the nervous system state arousal depends on. So the rushing doesn't just skip a physiological step, it can also introduce a mental distraction that compounds the problem. The myth of the 2-minute warm-up. Let's talk numbers, because I think this is where a lot of couples go wrong without even realizing it. Surveys on this, including work referenced by sex therapists and researchers, repeatedly find a gap. Many men estimate that a few minutes of foreplay is sufficient, while many women report they'd prefer closer to 15 to 20 minutes, sometimes more, especially outside of the very beginning of a relationship when novelty itself was doing some of the arousal work. That gap isn't a character flaw on anyone's part. It's usually a knowledge gap. Nobody sat either partner down and explained the actual physiology. Men aren't taught that vaginal lubrication and clitoral engorgement take real time to build. Women aren't always taught to advocate clearly for what they need, because for generations, this simply wasn't discussed openly. Here's the reassuring part. This is completely fixable. Once couples understand why the timing matters, it's not arbitrary, it's physiological. They tend to adjust naturally. This isn't about clock watching or turning intimacy into a stopwatch exercise. It's about understanding that rushing the early phase doesn't just feel less satisfying. It can also mean skipping the actual biological process the body needs to become ready, which affects comfort as well as pleasure. I want to be really clear on one more thing. There is no universal number. 15 minutes isn't a rule. What matters isn't hitting a specific time. It's paying attention to your specific body, your specific partner, and adjusting instead of assuming. I also want to address something that comes up often in early relationships versus long-term ones. In the beginning of a relationship, novelty itself is doing a lot of arousal work. New touch, new dynamics, elevated dopamine simply from newness. That's a real, documented effect. But novelty fades for every couple, not because attraction fades, but because the brain habituates to familiar stimuli over time. This is completely normal, and it's one of the most common sources of unnecessary worry I hear from long-term couples. It doesn't feel the way it used to, so something must be wrong. Usually, nothing is wrong. The neurochemical boost of novelty has simply leveled off, and that means the couple now needs to be more intentional about building arousal, rather than relying on it to show up automatically the way it once did. Intentional foreplay isn't a downgrade from spontaneous passion. For most long-term couples, it's simply what mature intimacy actually requires. Why goal-oriented touch backfires. This next point comes from a concept in sex therapy called sensate focus, originally developed by researchers Masters and Johnson, and it's one of the most useful frameworks I share with patients. The idea is simple. When touch becomes goal-oriented, meaning both partners are mentally tracking, are we there yet? Is this working? How much longer? It actually interferes with arousal. It pulls a person out of their body and into their head, monitoring and evaluating instead of experiencing. And when the mind is busy monitoring, the nervous system has a harder time doing the relaxed present work that arousal actually requires. This is part of why performance pressure is such a common arousal killer for both partners, not just men. If a woman feels like she's being watched, evaluated, or timed, even lovingly, even unintentionally, that mental noise can compete directly with the physical process trying to happen. So, one of the most evidence-supported shifts couples can make isn't a specific move or technique. It's a mindset shift. Touch without an immediate destination. Touch that's allowed to just feel good, without every touch being a stepping stone toward the next thing. Sensate focus exercises actually build this deliberately, starting with non-genital touch, no goal, no rush, just noticing sensation. Couples who practice this report, it retrains the nervous system to associate touch with relaxation and pleasure rather than performance and pressure. Practically, this might look like spending real, unhurried time on touch that isn't leading somewhere, the back, the neck, the scalp, the inner arms. areas rich in nerve endings that are often skipped entirely because they're not seen as the point. But neurologically, this kind of touch activates the same pleasure and bonding pathways, including oxytocin release, that help the whole system downshift into relaxation, which is the actual prerequisite for arousal to build well. I often describe this to patients using a simple mental image. Think of arousal less like flipping a light switch and more like a slow dimmer. Goal-oriented touch tries to jump straight to full brightness. Sensate, unhurried touch lets the dimmer rise gradually, and, this is the important part, a dimmer that rises gradually tends to reach a higher, more satisfying peak than one that's forced up too quickly. Rushing doesn't just risk an underwhelming result, it can actually cap how intense the eventual response is able to become because the body never got the chance to build up the full physiological response in the first place. I'd also add, this principle isn't one-sided. Men benefit from unhurried, non-goal-oriented touch too, and performance pressure runs in both directions. A partner who feels they're being timed or evaluated, regardless of gender, experiences the same sympathetic nervous system interference we're discussing here. So, when I talk about slowing down, I'm not describing something one partner does for the other. It's a shared shift in how the whole encounter is approached, and in my experience, it tends to improve outcomes for both people, not just one. The anatomy. Most people misunderstand. I want to spend a few minutes on anatomy because I genuinely believe this is where a huge percentage of frustration comes from: simple lack of accurate information, not lack of effort or care. For decades, anatomy education vastly underrepresented the clitoris. Older textbooks often showed only the small external portion, but research, including detailed imaging studies published over the past 2 decades, has established that the clitoris is a much larger structure than most people realize. Most of it is internal. It has legs, called crura, that extend several centimeters back into the body on either side of the vaginal opening, and it's rich with nerve endings throughout. By some estimates, thousands more sensory nerve endings than are found in comparable erectile tissue elsewhere in the body. Here's why this matters practically. Because so much of the clitoral structure is external facing only at its very tip, most women require some form of direct or indirect stimulation to that external area to reach orgasm. Research consistently shows that vaginal penetration alone is not sufficient for a majority of women. This isn't a flaw or a malfunction. It's simply how the anatomy is built. Multiple large surveys on this, including research summarized by organizations like the American College of Obstetricians and Gynecologists, put the number of women who reliably orgasm from penetration alone as a clear minority. I bring this up because I've had so many patients over the years who felt something was wrong with them, or their partners felt they were doing something wrong, when in reality, they were working from an inaccurate map. Once couples understand this, that clitoral stimulation isn't a bonus, it's often the primary pathway, a lot of frustration and self-blame simply dissolves. The second anatomical point I want to make: every woman's anatomy has individual variation in nerve density, in sensitivity, in what type of touch feels good versus overwhelming or even uncomfortable. This is exactly why I'm not going to hand you a rigid script today and call it universal. What I want to give you instead is the understanding of why variation exists, so you can approach your own body or your partner's body with curiosity instead of a formula. There's one more anatomical point worth mentioning because it explains a common source of confusion: the relationship between the clitoral structure and the front vaginal wall. Some women describe heightened sensitivity in that area, sometimes discussed under the term G-spot, and current anatomical research suggests this sensitivity may actually relate to the internal portion of the clitoral structure, those internal legs I mentioned earlier, rather than being a completely separate organ as it was once described. This is a great example of how the science has evolved. Older models treated these as distinct structures. More recent, better imaged research suggests a lot more interconnection than previously thought. I mention this not to give you a new target to chase, but because understanding that these aren't separate, competing zones, they're part of one interconnected structure, tends to reduce the pressure of finding the right spot and replace it with a more accurate, less stressful picture of how arousal is actually distributed through the body. I also want to gently push back on the idea that more pressure or more intensity is automatically better. Nerve density is high in this entire region, which means for many women, especially early in arousal, lighter, indirect touch is more effective than firm, direct pressure. Direct contact to the clitoral glands specifically can actually feel overwhelming or even uncomfortable before sufficient arousal has built up. This is highly individual, which is exactly why the earlier point about communication matters so much here specifically. There's no way to know the right amount of pressure or directness for a given person without them telling you, because it genuinely varies from one woman to the next, and even from one day to the next, for the same woman. Communication as a clinical tool, not just a nicety. I want to reframe something for you. Communication during intimacy isn't a soft skill add-on. From a physiological standpoint, it's one of the most powerful tools available because it directly reduces the mental noise we talked about earlier, and it helps a partner get real-time, accurate information instead of guessing. Research on sexual satisfaction consistently finds that couples who communicate openly about what feels good during and outside of intimacy report higher satisfaction than couples who rely on assumption or nonverbal only cues. That's not a surprising finding once you think about it. Guessing is simply less accurate than being told. A few practical, non-awkward ways to build this in. Outside the bedroom, in a relaxed moment, this is genuinely one of the most underused tools. A calm conversation, not during intimacy, about what feels good, what doesn't, what you'd like more or less of. Removing the conversation from the moment itself takes the pressure off both people. In the moment guidance that's affirming, not corrective, something like guiding a hand or a simple right there or a little softer, framed as adding information, not as criticism. Patients consistently tell me this small shift in tone changes how safe it feels to give feedback at all, checking in without interrogating. There's a difference between "how does this feel?" asked once, warmly, and constant narration that pulls both people out of the moment. A little goes a long way. I'll say this plainly because I think it needs to be said. If there's one single change that improves outcomes across nearly every couple I've spoken with, it's this. Normalizing communication about sex the same way you'd normalize communication about anything else that matters in a relationship. It stops being awkward once it stops being taboo. I want to acknowledge something honestly, because I think pretending otherwise wouldn't serve you. For a lot of couples, especially those who've been together for years without ever really talking about this, that first conversation feels genuinely awkward. That's normal, and it doesn't mean you're doing it wrong. I usually suggest starting small, not a big sit-down, we need to talk conversation, but a low-stakes comment in a relaxed moment, something as simple as mentioning one specific thing you enjoyed after the fact. Positive, specific feedback given outside the heat of the moment tends to open the door far more easily than criticism or a formal discussion ever does. Once that door is open even a little, it gets easier every time after. I also want to note that communication isn't only verbal. Guiding a partner's hand, adjusting your own position, a change in breathing or sound, these are all forms of feedback, and a partner who's paying attention can learn a great deal from them. But I'd still encourage adding words where you can, because nonverbal cues, while valuable, are also the easiest to misread, especially early in a relationship or if either partner is anxious or distracted. The role of the nervous system. Why stress is the silent saboteur. Here's a piece of physiology that I think gets completely overlooked. Arousal is largely governed by the parasympathetic nervous system, the rest and digest branch, the same system responsible for relaxation and recovery. Stress, distraction, and vigilance activate the opposite branch, the sympathetic nervous system. Fight or flight. These two systems don't run well at the same time. This is why a woman who is mentally cycling through a to-do list, or feeling emotionally disconnected, or carrying unresolved tension from earlier in the day, may find that her body simply doesn't respond the way it should, no matter how technically skilled the touch is. It's not a lack of attraction. It's a nervous system that hasn't downshifted out of alert mode. This is also part of why emotional connection isn't just a romantic nicety, it's physiologically relevant. Feeling safe, seen, and emotionally close with a partner measurably supports the parasympathetic state that arousal depends on. Rushing past emotional connection into physical touch, especially after a stressful day, is often working against the body rather than with it. Practical takeaway here: transition time matters. A few minutes of decompression, talking, laughing, simply being physically close without immediate expectation isn't a delay before the real part starts. Physiologically, it often is the real part because it's doing the nervous system work that makes everything after it work better. I want to give you a concrete example of how this shows up because I think it makes the concept click. I've had patients describe evenings where everything on paper should have worked. Time available, willing partners, no obvious problem, and yet arousal just wasn't there. Almost every time when we dug into it, one partner had walked into the bedroom still mentally mid-argument about something from earlier, or replaying a stressful work email, or simply hadn't transitioned out of caretaking mode from a long day with kids. The body doesn't compartmentalize as cleanly as we'd like. If the sympathetic nervous system is still partially engaged from the day's stress, it doesn't just switch off because the setting changed. This is exactly why some of the most effective advice I give isn't about the bedroom at all. It's about the 20 minutes before it. A warm shower, a few minutes of quiet conversation that has nothing to do with logistics or responsibilities, even simply naming out loud, "I'm having trouble getting out of my head today." These small transitions do real physiological work. They're not optional fluff tacked onto the beginning of intimacy. For a lot of couples, they're the actual missing ingredient. What about lubrication and changes over time? I want to address something a lot of women ask me about privately. Natural lubrication can vary day to day across the menstrual cycle, with stress levels, medications, and significantly with hormonal changes like those during perimenopause and menopause, when declining estrogen commonly reduces natural lubrication and tissue elasticity. This is medical, not personal. It doesn't mean arousal isn't happening or that attraction has changed. Extended, unhurried foreplay actually helps here because it gives the body more time to produce what natural lubrication is available. And when that's genuinely not enough, which is extremely common, not rare, a good quality, body-safe lubricant is a completely normal, medically sensible tool, not a sign of failure. I'd encourage anyone experiencing persistent dryness or discomfort to also mention it to their own physician, since there are effective, well-studied options, including topical treatments for menopause-related changes, that can help. I say this because I don't want anyone watching this to feel like their body is broken. Bodies change, physiology adapts. None of it is a verdict on desirability or on the relationship. Putting it together. Principles over scripts. I'm not going to leave you with a rigid step-by-step, because if you've been listening, you already know why. Bodies are individual, and a formula that ignores that isn't actually science-based, it's just a different kind of myth. What I want you to walk away with instead are the principles, because these are what the research actually supports. Give the process real time. Physiologically, arousal builds gradually, and rushing it works against the body, not with it. Prioritize connection and reduced pressure before intensity. A calm nervous system is the foundation everything else is built on. Understand the anatomy accurately, especially the central role of the clitoris, so effort is directed where it's most likely to matter. Communicate directly, warmly, and outside of the moment as much as in it. And extend genuine patience to natural variation, day to day and across life stages, rather than treating variation as a problem to be fixed. Couples who build these principles into how they approach intimacy, not as a rule book but as an understanding, consistently report more satisfaction, less pressure, and honestly, less of the quiet anxiety that so many people carry into the bedroom without ever saying out loud. If this helped you understand your own body, or your partner's, a little better, that's exactly why I make these videos. Hit like so more people find accurate information instead of myths. Subscribe if you want more science-based, no-nonsense breakdowns like this one, and drop a comment. I read them, and I often turn the most common questions into future videos. This channel exists because these conversations deserve real answers, not embarrassment. Here's what I want you to take with you. There's nothing wrong with needing time, needing communication, or needing your specific body to be understood on its own terms. That's not high maintenance. That's just biology. The couples who navigate this best aren't the ones who found a secret trick. They're the ones who got curious about the science, dropped the pressure, and started treating intimacy as something to understand together rather than something to perform. You deserve that kind of understanding. And now you have the science behind it. I'm Dr. Lila Romano. Take care of yourselves and each other. I'll see you in the next one.